Well, I mean, they've been, first of all, massive kudos to community pharmacists who've done an amazing job in being accessible. I take my hat off to them first. But thinking specifically about practice pharmacists, the guys that work for us, with us, they've been at the front line, often the only clinician seeing patients, reviewing them online. Initially, there was a massive need for people's prescriptions, because they're kind of panicking, getting repeat prescriptions, lots of queries. So they were very busy dealing with all of that, ensuring, I think, and now as time goes on, it's about kind of returning to kind of some sort of new normal, doing medication reviews remotely, and also case finding proactively still, and providing remote consultation. So we've done quite a lot of work with some of the early days webinars about how you do remote reviews for patients. Which patients do you find? And there's a lot of concern about people just either not being able to access primary care or choosing not to and withdrawing, and then the condition deteriorates. So pharmacists are really well placed to identify some of those patients and support patients remotely. A great example was that around the country has been in the area of atrial fibrillation, where pharmacists have been titrating or changing their patients onto DOAC sometimes, where that means they don't need the INR testing, for example. Yeah, another example that we've been working on is in the area of osteoporosis, where particular agents that would have been kind of supplied through hospital, denosumab is probably the one that comes to mind. The patients have just been kind of falling off a little bit, not going for reviews, not getting the prescriptions, and the practice pharmacists have been able to identify those patients and ensure that treatment is continued. It's been great to see their growth so far. So some that started as junior pharmacists a short couple of years ago, now senior pharmacists. So they started with the clinical role, then they kind of took on a senior role, and the next phase I discussed is kind of leading the whole team at a PCN level. And what's actually happened is they haven't changed hats. They put the first hat on, the clinical role, then they put the second hat on, and the third hat on top, and it's just starting to get. So how are they going to find headroom to develop this? I think it's great, the ideas and the vision is there to an extent, but I think what I'd like to see is a bit of structure and a bit of support around making that happen at scale thinking, and I think leadership skills development, but also giving the pharmacists, the senior pharmacists, and even some of the junior, some headroom to kind of grow. And then I hope that through that support, they themselves will then capture the outcome. So actually, if we're having this conversation in hopefully not as long as 5 years, maybe 2 or 3, I can give you a whole list of initiatives that have been run utilizing pharmacists, and we're able to see that actually they're not the understudy or a sidekick for GPs. They're actually an independent profession adding real value themselves.